Top of the day to you, our great friend. Thank you so much for joining us this lovely, lovely day on Leadership Lab. Well, on Leadership Lab today, our topic will be transforming tuberculosis diagnosis in Nigeria, the FCT experience, and the 1 billion naira support by the First Lady of the Federal Republic of Nigeria. My name is Oche Otene, and my guest today is a public servant. Dr. Adam Babagana is a permanent secretary, Health Services and Environmental Secretariat. Thank you so much for joining us.
Thank you, Oche, for having me.
Interesting indeed. Talking about tuberculosis, how challenging is it?
It's very challenging because we are number 6 globally in terms of TB, and either first or second in Africa, after South Africa, of course. Then globally, I think India, Pakistan, Malaysia, Indonesia, Nigeria, South Africa. So it's very challenging in the sense that it affects the poor, and mostly is a disease of the poor, unfortunately. And the environmental factor plays a role, poverty.
Okay.
You know, when there is overcrowding in a room, overcrowding in buses, overcrowding at workplaces, and what have you, brings it. So once something is general, you know, it becomes more and more challenging for you to face it. So it's not a rare disease, it's the greatest, one of the greatest killers of humankind. AIDS, tuberculosis, and malaria. And if you recall, it was in the year 2000, during President Olusegun Obasanjo and the terror of Kofi Annan.
Okay.
There was this Abuja declaration in the year 2000, where the Global Fund to fight against AIDS, tuberculosis, and malaria was set up to face AIDS, tuberculosis, and malaria. So TB is very challenging.
Interesting indeed. And that brings me to the next question. You know, most of the times you hear Nigerians say things like disease not the killer, disease not the kill, Africa, and what have you. That's cliche conversation there. And most times you see someone who is coughing, the next thing he goes taking Agbo and what have you. I would like you to speak on that.
Thank you. You mentioned Agbo. I've been battling to have that Agbo. In fact, our health-seeking behavior contributes to the issue of tuberculosis and several other diseases. You know, we keep harboring it for a very long time before we get it diagnosed. You know, early diagnosis gives room for early treatment. And once you're diagnosed early, you know you're cured, so you go back on your beat.
Okay.
That is the most critical issue. So, but you know, our tradition, our belief, we are too much believers of juju and superstition. It's either your villagers are following you, or your mother-in-law, or you know, your stepmom doesn't like you. So, if we don't move this myth that it's evil spirit or one kind of ailment in your village that is attacking you, we wouldn't get there. So TB is purely a bacterial condition that affects people, and especially poor people, and is spread through air droplets.
Okay.
So that's why it's easily spreading. One person infected can infect 10 more people. So it's exponential. And mathematically, it spreads like wildfire. That's why it said TB anywhere is TB everywhere.
Okay.
So, and that is the biggest challenge.
So interesting indeed. We've seen the First Lady of the Federal Republic donate 1 billion naira to aid, the end to TB in Nigeria and even in the nation's capital. How significant is that contribution?
It's very significant for us that have been working on tuberculosis for a very long time. Once upon a time, around 90s, specifically like 1996, we started a small NGO in my community in Maiduguri. We call it Society for the Prevention and Eradication of Tuberculosis in Nigeria.
Okay.
Once upon a time, TB drugs are not provided for free. You have to buy them, and it's very expensive. So people were dying. Thanks to the Abuja Declaration and thanks to the Global Drug Facility, GDF, that now said, okay, to cater for these, drugs have to be free and the tests have to be free. and equipment for testing were developed, like the gene expert machine. Now we have the molecular biological level that is called TB that the First Lady just purchased when she donated the 1 billion naira at Sauka village along the airport road during the World TB Day. You know, she's a global TB champion.
Okay.
So she gave that. And how is it very impactful? Government alone cannot do it. To build a hospital is not cheap. To maintain health workforce, I don't know if Oche knows, our health care workers are the most highly paid in this country because their salary is different from the ordinary civil servant. So to say government is not doing anything is an understatement.
Okay.
So to cater even for their salaries and allowances and condition of service is another battle. To maintain the hospitals and equipment and facilities is another battle. So government alone cannot do all this personnel, infrastructure and structure. So we were about 15 years ago looking for how indigenous funding can augment TB. And 25% of whatever that is provided is what Nigerian government is given, both at the state, local government and federal level. So 75% was coming from donor, multilateral and bilateral. So this income is scarce. It's just like a drop in the ocean.
Okay.
So for the First Lady to step up at Sauka village to announce the donation of 1 billion, that tells you a lot. If you take
over time, we've heard of these donations. We've heard of one in Benue, another in Niger. And the issue of trust. Some Nigerians will be like, are these mere declarations or they're actually happening?
I witnessed the equipment arrive today at Buhari. In fact, I will tell you, Dutse Makaranta, Primary Healthcare Center. I'm just coming from there. And if you can see my t-shirt, we went to commission that and we unboxed the equipment provided by the First Lady of the Federal Republic of Nigeria. From the money she donated, this equipment were purchased and delivered in real time. So it's not like, oh, it's not been loaded, oh, it's at the port, okay, it's not been cleared, etc., etc. So we unboxed it. The Minister of Health was there. The Minister of FCTA was there. My boss, Dr. Dedolapo Fashawe, was there. The wife of the Kwara State Governor, the chairperson of the Governors Forum, the professor, she was there. The chairman of Buhari Area Council was there. All the chiefs of Buhari were there, and the community were there. So all the equipment were demonstrated, displayed, unboxed. So people can, that's why this administration is called renewed hope. You know, people have become hopeless. So to renew that hope is for people to believe in what they are doing. And if you can see even from the delivery that is happening in the Federal Capital Territory in terms of infrastructure, once a project is flagged up, it is also commissioned. And now you drive on the roads. You drive on it. So just to follow that footstep exactly, we just commissioned the TB lamp for diagnostic purpose. And you know, diagnosis is like 50%, if not more. Because if you don't know your problem, it's a serious mental health. But if you know your problem, solving it are steps. You can go to Oche, you can go to this young man, and you have a solution. So for me, I think to start being pessimistic, I think that era is gone, especially under this administration and the First Lady, because the money she gave, the money has been put to use, and people are already benefiting from the diagnostic equipment.
So when it comes to community approach, to what extent are FCT residents going to feel this impact? I mean, a whole community approach. What are the strategies in place?
The strategies in place is that, like we all know, in terms of laboratory equipment for testing tuberculosis and any other, FCT can only compete with Lagos. So, and the laboratory equipment that have arrived, that's why we're flagging up in Buhari. We didn't flag it up in Maitama, Asokoro, or an elitist setup. We did it at Dutse Makaranta, Dutse Alaji Axis in Buhari Area Council. It's a primary healthcare, and primary healthcare is the answer to all the challenges. So for me, I think it's addressing the issue that this administration is trying to confront head on by tackling primary healthcare issues and also pension, health insurance, because affordability comes with health insurance. So at the end of the day, this is what that is going to deliver on our healthcare system.
Okay, is there like an agenda that we're looking at to ensure that, okay, maybe in 2030, in 2029, TB comes to a close in Nigeria?
2030, TB is eradicated.
Okay, and I'd like you to just paraphrase and give us the narrative and the agenda that is being followed.
What is being followed is that there are several strategies. One of the strategies is workplace tuberculosis.
Okay.
So, like corporate organizations and others, just to increase the productivity and also destigmatize the condition.
Okay.
So it's the workplace. Then faith-based organizations, like deliberately, the Global Fund through the Nigerian governance system, national and subnational, they are going to be provided with some X-ray equipment. And as a matter of deliberate policy, in every state, one of the X-ray or equipment will be located in a faith-based place. So that at least they will also respond to it, apart from the public and private things. So these are all tax sub-activities that are put in place towards reaching that eradication in 2030. You see, you can't say you want to eradicate TB in 2030, then your diagnostics are not well distributed. They are not even procured. You have not even trained the personnel to handle it. So at the end of the day, you cannot, if you don't have the person that can drive the type of car you are bringing. And all these equipments are latest, state-of-the-art, and they are computer-based and computer-driven tools. So things have been put in place right at the ward level to the national level to see that TB is catered for.
So to the average man watching us at the moment, who maybe has a relative or sibling who is going through TB, is there that fast speed line that they can dial to maybe get treatment or something?
See, like I said, all diseases in Nigeria, TB is one of the oldest, and TB has all the tools towards eradication of a disease program. So when HIV came and other diseases followed, they all used the template of tuberculosis to restructure and structure their mode of response. So for TB to be completely eradicated, I think first and foremost, communities need to be enlightened. And I think that's what we are doing. When you invited me, or when I came, speaking about it, you talk about something, people get to know about it. First, you don't know something, you can't handle it. So when you get to know about it, then you have a solution to it. So I think at this level that we are going, at the community-based organizations, at the non-governmental organizations, civil society organizations, as well as market level campaigns, church and mosque level campaigns, because sometimes we even insert into the sermon of the pastor every Sunday to speak about TB. That if you are coughing for more than 2-3 weeks, consult your doctor, go to the primary health care. You get? Testing is free, treatment is free. So if it's in the mosque on Fridays, you do that. That's more that we get. Now with the social media, we have e-coffee, you understand, where we also discourage the agbo. That's the name I've been looking for since morning. People now think when they take agbo, it's so.
But it's taking herbs a bad thing.
Even the drug you are taking to cure TB is part of herbs sometimes. Even the anti-malaria care is herbs, but it's not scientific. You know, you are just given a bottle and a dosage. You consume it ad lib. So that is why a lot of people now come with liver and other elements. But if it is scientific, proven, tested and trusted, and then there is a measurement for which you can swallow, it's not. But you can't just give somebody bitters, whatever, and that person swallows it every day without regards to when it is even researched, without knowing the side effects, then it's a big problem. Then people now like the agbo. How is it scientific that agbo can cure TB? None at all. So and that's why it's been lingering.
Interesting. Many would think that the FCT minister is only concentrated on developmental projects like roads and not necessarily concerned about health. But talk to us. This TB approach, it seems to be a whole community approach.
Yeah, it's a whole community approach, and even our health, there is a declaration the minister has made on free healthcare for pregnant women that go to deliver in our hospitals.
Okay.
All you need to do, you pay your premium at the FCT health insurance. You get free. And let me tell you something you didn't know. When people don't see, they say all sorts of things. This minister has paid all the backlogs of insurance owed to HMOs and health facilities since inception. In fact, we have now even postpaid.
Okay.
Do you get what I'm saying, sir? Insurance premiums are paid on a regular basis, quarterly basis.
But the issues about
The
doctors
minister
being on
has
strike.
paid. This is something that is institutional.
Okay.
It's just like for you to say ASU has been on strike. Right in my days, in the 90s, ASU has been on strike, and we lost even a whole year. So a government cannot just change its trajectory within a single term. It needs time to heal, yes. So when you say this thing has been lingering, maybe it's an ailment that you allowed to stick into you for a very long time. But when you come at the earliest point of that ailment, maybe the place would just be incised and removed and it won't be there. So what I'm trying to say is that paying insurance premium and declaring that childbirth at our hospitals by pregnant women free is something fundamental, but it is only those whose wives or daughters have delivered that we get to know it, because we are not on television saying this is what on this, except on this occasion that you are asking for it. So it is not only the roads and bridges, but the policies that is put in place, like health insurance of the FCT, which is tailored around the National Health Insurance Authority, NHIA. You pay a premium of 13,500. It's now been raised a little bit because of cost of things. You pay 22,500 for yourself. You get every treatment at 10% cost. So let's say you now subscribe or pay your premium to FCT Health Insurance. You pay 22,500 for a year. If you are charged 1 million naira for drugs and other things, you only pay 10%. That's just 100,000. If you are charged 10,000, you pay only 1,000. If you are charged 100 naira, you pay only 10. So that puts money into your pocket indirectly. And when a pregnant woman comes through the primary healthcare system to our secondary healthcare system, through referral, everything that will be done to her at that hospital is free. We have free antenatal care, FANC, free. We also have free under 5 treatment at the government facilities. Anybody below 5 years who had treatment at the hospital is free. So you take the insurance, it becomes even more freer. So there are a lot of things happening, and all the payments of whoever you're talking about the strike have been paid.
All right. As we begin to wrap up the conversation, when it comes to collaboration on TB, to what extent can we say the FCTA has gone? Yes, the 1 billion naira donation from the First Lady, it's beautiful. Are we extending an olive branch to others?
Well, what I would just tell you is that I earlier told you that the national and subnational contribution of resources is just about 25%.
Okay.
75% or more comes from donors. And now with the coming of Donald Trump, funding stream from USAID in particular has shrunk almost to zero, affected human resource and what have you. So what is to be done? I told you 15 years ago, we are looking for so many strategies to make sure we're independent, almost independent, that we can source for money, we can source for resources indigenous. The Coca-Colas, the Pepsis, the Otedolas, the Dangotes, the Boas, so that they can now contribute money and augment the First Lady. But first and foremost, the First Lady has to be commended And these are the kind of imitations we want to see replicate.
Okay.
Other people can step up with their 1 naira, 10 naira, 100 naira, 1,000, a million, a billion, to match. The churches, the mosques, what have you, can even create a tie so that everybody that wants to help, any rich man, Otene, myself, yourself, no matter how you can step up.
Okay.
Wherever occasion you go, talk about TV, speak about TV, educate about TV. So once people get to know about TV, they'll get to do what is right. And at the end of the day, donation becomes infectious.
Okay.
So we become independent in our health and resourcing and financing. So our resource mobilization network grows beyond the First Lady. But first, we need to commend her and give her kudos that she has done something that nobody has done it. Stepping up for tuberculosis in particular, to give 1 billion naira. No individual in this country has done it before. So kudos to the First Lady for doing that through her Renew Hope initiative that is stepping up. Others might have given some things before, but it can't even take care of a laboratory somewhere. And the equipments are here, the money has been put to use, and the testing, we just commissioned it today. And it was launched at the highest level, and people are already benefiting.
You are very instrumental with this administration, I mean in the FCT of course. And a lot of FCT residents have expectations as we wrap up. What would you say to some of these expectations, even when it comes to health?
Some of these projects the Honorable Minister is commissioning have been abandoned for over 20 years. He just resuscitated them and used his margin one and got resources and funded them. And a lot of the districts in FCT are opening up, and they have opened up. And a lot of the people that hitherto don't have jobs to do are getting jobs to do. Because don't forget, apart from provision of the infrastructure, it's human beings that do the work through the contractors. So for me, I think it's the only normal for people to expect more. Because if they are used to dormancy, they won't even expect they have given up. And that's why, like the minister will always tell you, President Bola Ahmed Tinubu, GCFR, gave us the impetus to even do what is to be done, supported by the National Assembly, and the Honorable Minister's capacity, capability, and willingness to deliver on time at the right time now is whetting a lot of appetite. Everybody is now showing his road to be done.
Interesting indeed. It's been a remarkable moment with our guest, Dr. Adam Babagana, Permanent Secretary, Health Services and Environmental Secretariat. Any final words from you?
Well, as per FCT, since you're talking about FCT, just pay all your taxes so that at least more of the goodies will come your way. Because the more money, the more tax you pay, the more infrastructure will come to you. Like the minister will always say, it is from the same money being generated that he works with. So I think we should be paying our taxes, we should be law abiding, and we should pray for our leaders to succeed in whatever they are doing. It's just like being in a plane. Okay. You pray for your captain for a safe takeoff and a safe landing. So we should pray for our leaders and look forward and always be positive.
We truly must thank you, Dr. Babagana. Thank you for coming. And that's how we wrap it up here on Leadership Lab today. My name is Oche Otene. Thanks for being there.